Underwriting for the Money Doctor Show is provided by Ryan and Casey Liquors, Main Street, Greenfield. Exploring the world, one glass at a time. West County Equipment Rental of Shelburne. Daily, weekly, monthly rentals. 625-6463 or on the web at westcountyequipment.com. Weld Communications, Marketing and Publicity. Helping businesses spread the word in the Pioneer Valley and beyond. www.weldwords.com.
There's a better life if I could be debt-free, but all my money is a mystery. I was feeling overwhelmed and it was wearing thin when I knocked on the door and heard the doctor's in. Oh, the doctor's in, the doctor's in. She got the right prescription to help you win. Oh, the doctor's in, the money doctor's in.
Hello and welcome to the Money Doctor Show. I'm Dr. Frances Rahaim, president of Power Down Debt, a positive debt management company. And when I mention plastic surgery, probably the first things that come to mind are, let's see, breast implants, facelifts, tummy tucks, rhinoplasty. But what about things like constructive surgery and freezing your fat? Yep, you heard it here, folks, freezing your fat. It's the newest thing on the market. I have with me today Dr. Glen Broooks and Leah Kenny. Welcome.
Hello.
Thank you. Dr. Glen Broooks is a plastic surgeon, and Leah Kenny is a physician's assistant, and they are both from, Aesthetic, Plastic, and Reconstructive Surgery PC?
Correct.
In Longmeadow, Mass.
If I had made the name shorter, it would have been easier.
Yeah, well, it would have been, but that's okay. And I should say at the beginning of the show, we have a prop on our table. I'm not going to say what it is. I'm just going to let people wonder for a while.
I don't think they'll wonder for long, but...
You don't think that? I don't know. From that angle, I think you could wonder a little bit. So your practice was voted the best place to have cosmetic surgery by the Valley Advocate Readers Poll in 2009, 2011, 2012. You folks have to be doing something right there.
Well, you know what? I personally have a great staff, and the support system really makes a difference to doing great work.
Yeah? I knew you would say that right away. So you've been in practice since what, 1992?
92,
okay.
Yes.
And how did Leah join you? When did Leah join you?
Leah was actually a student with me from coming out of Springfield College from the PA program, and I hired her as quickly as I could as soon as she graduated.
And she stayed all this time?
Well, I was smart to keep her.
That too. Oh my gosh, where to start? Let's start with Angelina Jolie and what's gone on with her right now with these mastectomies that's in the news. She underwent bilateral prophylactic mastectomies in order to try and avoid breast cancer.
Correct.
What do you think about that?
Well, you know, I think this is what we're seeing over the last couple of years. Patients are very nervous. The numbers are really up. I mean, when you talk about the numbers of 1 in 8 women over the course of their lifetime getting breast cancer.
Wow.
And when you have a hereditary risk factor, certainly those numbers go up dramatically. What we need is better genetic testing than what we have now, so that we can actually better define who those specific people are and what their risk factors are, so that we don't necessarily have to be quite as destructive or reconstructive at the end of the time.
Right. And so the testing, how would you think that the testing needs to improve?
Well, we need to define it better to really see what that risk factor is. I mean, if you're BRCA 1 or 2 positive, then that globally puts you into a high risk factor. But if we knew better whether that was really an 80% risk of getting breast cancer over the course of your lifetime, or had better scans to detect it earlier, we might not have to do mastectomies per se, and maybe be more conservative. Yeah.
What percentage of your practice do you think comes in as breast reconstructive surgery after something like that?
It's probably 20% overall is breast reconstructive.
Okay.
We do a lot of breast surgery in general, whether it's cosmetic or reconstructive.
Right.
And breast reduction, for instance, ends up in that reconstructive side of things. But it's maybe a little bit of both, but it's reconstructive.
Certainly has come a long way over the years, of course. I can't ask you about plastic surgery practice without talking about Botox and Juvederm and whatever else is on the market. And Leah handles a lot of that, right?
Yes, absolutely. Both my PAs do a lot of the injectables. I'm very busy with the surgical side of things, and they're experts at taking care of those non-invasive types of treatments.
Okay. Tell me about it, Leah.
Well, you know, it's a really nice adjunct to the things that we do, but it's also sometimes a lead into the practice. Patients wanting to do a little something, maybe that doesn't include the downtime as surgical procedures. It's become much more mainstream, although in Western Mass, people maybe don't wear their Botox as a badge of honor the way they may in some larger cities. But it's an in and out procedure. It really delivers consistent, reliable results each time we do it. Many times I'll have patients coming in thinking they want a little skin care, you know, maybe they want a prescription for Retin-A. Really what they want is Botox, but they come in and they say, I'll have anything but Botox. And then I tell them, addressing the concerns they have with their specific wrinkles would be like trying to treat a fever without Tylenol or Advil, in terms of trying to treat those wrinkles without a neurotoxin like Botox. So sometimes it takes certainly some explaining. We talk about the procedure, the risks, and most patients, once they're on board, they are on board. What do they fear? That you're putting a poison in their body? Or exactly. And I think I can remember the conversation we had with each other 10, 11 years ago when Botox was first becoming a part of our practice. Oh, no one's going to want that. It's expensive, it's temporary, it's a neurotoxin. But when it consistently delivered the results the patients were after, and it has such a really good safety profile, we've never seen a serious adverse event with Botox Cosmetic, which is the one that we use. It became really the key to fixing some of the lines that patients are concerned about. Wow.
And the trade name is so well known, Botox, and it's become so mainstream. Yeah. But every once in a while, the media will pick up some sort of horror story, which really probably is either not significant or really not related, but it scares people. Yeah, yeah. Well, I suppose that's always the scary thing. You know, every drug that comes out or every procedure that comes out, it all looks good on the surface. Yeah. And then 5 years later, you see commercials on the TV that say, wait, this was great for you until you developed Labrador head retriever disease, or whatever. I mean, you never know in the beginning. But for a lot of those procedures, they're not elective. So when you're talking about elective surgery, patients are choosing to have something that they're paying for that they don't have to have. Yeah. It raises the hair on the neck just a little bit about, okay, how safe is this? How comfortable am I doing this? Well, that brings up a good point. With the economy the way that it is, how has that affected your practice in elective cosmetic surgery? Well, at least for me, the changes are really in that early recession period of time where we started doing less surgical procedures, we saw less patient visits. But what we saw change, and this is pretty well described nationally too, was things like facelifts really went down, but the injectables kind of hung in there and probably increased during that period of time, because people would say, look, I don't want to spend the kind of money it takes to do a facelift, but I would definitely consider doing something that's less costly, maybe get me through the next couple of months, years, whatever it takes. And then, when I'm comfortable with my salary, or when I have a job, or when I'm making more money, whatever, then I'll do the surgical intervention or the surgery that'll make me look better. I think too, they were really worried about job security and hesitant to take time off. We definitely had people that were, thinking of having a surgery that might lead to 1 to 2 weeks vacation time, and instead they said, "Oh, maybe now's not the time." They were seeing people get cut at work and layoffs, and so they came in for some more of the non-invasive procedures that we offer. Interesting. I would say from my viewpoint, where I deal with people with money all the time, they will often take on small expenses that they can do often. They might do, I don't know, $500 4 times a year, when they won't do one expense that is $2,000 immediately, because they can space it out and they don't feel that. Yeah. Before the show, I was saying I had thought of all kinds of things I could say to you, and through my head went, you guys really have a cutting edge practice, and I swore I wasn't going to say it because I thought it's such a bad pun, but you really do. And talking about skincare makes me think about your spa and your line, 2 different things, maybe the spa and the line of skincare products that you have. So tell me about the skincare products. How did that happen? I'm going to start with it, and then I'm going to turn a little bit over to Leah as well. For one thing, what I've always tried to do is have some balance in the practice. And if you're just doing surgery, you kind of miss out on the fact that if you do surgery on the face, for instance, patients probably need camouflage makeup afterwards, and you can't just send them anywhere. They probably need to know how to take care of their skin, because we may change the structure, but there is kind of the canvas of the picture that needs to be looked at, whether it's wrinkles or pigment or whatever, because it's not going to look great without that. So from my perspective, I need to look at it and say, okay, I need the whole picture. I need to be able to prescribe skincare for patients, and we need to be able to do laser or peels or something else to work on the skin while we're also working on the underlying surface. And so we needed that side of it. And we started off with national-based products. But eventually we really looked at it and said, okay, we need something that actually is specific to our practice by someone who's an expert, and that's when we started with our own skincare line. And the purpose was to really be specific to things that we thought would not only work, but also be specific to things that we do.
Okay, so where does Leah come in this?
Well, Leah can talk a little bit about how we just actually tell patients what they can use and what they should use, and how some of that's transferred to the spa, but a lot of it happens in the practice downstairs. When she's seeing a Botox patient, for instance, she will look at them and say, are you on Retin-A? Are you on our skincare line?
Right.
What are you looking at right now? What do you need?
Yeah, I remember I had a little brown spot on my leg, and I got some bleaching cream from you that worked pretty well. Oh, and laser. Did a little laser thing on my leg. So, so that was pretty interesting to be able to do those kinds of things, and other things as well that people, I think, help people to feel better about themselves in general. Yeah. To me, that brown spot was like an age spot. I was like, oh my God, I have a brown spot on my leg. I didn't have that before, Leah. Check this thing out, right?
Right.
So, all right. So, how did you develop this line? I mean, did you just?
There's actually a chemist in Connecticut who's doing it for, I don't know, probably 30 years.
Yeah.
We're doing dermatologic type of products for dermatologists and plastic surgeons.
Starting out on Park Avenue in New York City as a new graduate chemist in the back rooms with the doctors, mixing things up that they thought were appropriate for the patients.
That's cool.
Because it really maximizes the effects of some of the things we do with the laser or with surgery.
Yeah.
And a lot of it started up by chance. I mean, the original peels were by lay people behind closed curtains and doing these very destructive things that had really great results. But it took plastic surgeons to integrate that. But in my mind's eye, you needed science behind it. And this one guy is a scientist, and that makes the most sense for what we're doing.
That's really cool. We're going to take a break in a couple of minutes, and we're going to come back and talk about freezing your fat, which I know you have a great name for, but I like to call it freezing your fat because I found it fascinating. But in short, you're Harvard trained, you went to Springfield schools, South Boston started out, all of this sort of thing. How do you end up in Longmeadow in a local practice, and why?
I finished my plastic surgery training in Boston and wanted to stay in New England. I was very attracted to the fact that Bay State Medical Center had a great name. I want to be working at a place that I could start out in a place that didn't have 18 plastic surgeons at it who were also trained similar to me. And give me a chance to start out fresh and do some things in a place where I could really kind of garner in all the things that I wanted to do and not be sharing with a lot of people. And that's worked out well for starting out doing a lot of really complicated plastic surgery procedures and having enough numbers to do it and not feeling like I'm doing one or two of things because there's 18 other people doing the same thing.
Wow. Leah, and you came to the area because?
I went to the PA program at Springfield College, was one of the first classes to come through, met Dr. Broooks as a student and really fell in love with plastic surgery.
Yeah.
And just the different things that we could be doing, do one thing in the morning and by afternoon something totally different. I really liked that. I liked the surgical aspect, but I also liked that, I'm with Dr. Broooks in the operating room a couple days a week. I'm in the office seeing patients a few days, so I like being able to develop that rapport with patients, but I still really enjoy the technical aspect. I did think I would end up back in Boston after school. I did a number of my rotations in Boston, in the Boston hospitals, had good experiences, but really like living out here in Western Mass. I was with Dr. Broooks for 10 years before I had a family. Now that I have a young family, I have found Western Mass suits us even better because you can put in a full day's work and still expect only a 10 or 15 minute commute home.
Right.
So, that for me has been, really helpful.
In speaking to some of your staff about, I want to find out what the humans are like underneath the professionals here. The one common thread was always that you both have families and you both put your families first. And so I love that we get you here in Western Mass. So I'm speaking with Dr. Glen Broooks and Leah Kenny, physician's assistant. We'll be back in a moment and we'll talk about cool sculpting.
Underwriting for the Money Doctor Show is provided by Ryan and Casey Liquors, Main Street, Greenfield. Exploring the world, one glass at a time. West County Equipment Rental of Shelburne. Daily, weekly, monthly rentals. 625-6463 or on the web at westcountyequipment.com. Weld Communications, Marketing and Publicity. Helping businesses spread the word in the Pioneer Valley and beyond. www.weldwords.com.
Welcome back to the Money Doctor. I'm here today with Dr. Glen Broooks and Leah Kenny, physician assistant. I've just learned there's no S on that. Thank you very much. This is why they are doctor and physician assistant and I am not. Okay, so we're back. And let's talk a little bit first about this riddle we have on the table. What is this?
This is a silicone breast implant. And as you can see, it's actually a shaped breast implant. It's narrow at the top, fuller at the bottom. and it's silicone-based. Silicone was re-approved by the FDA in 2006. So it's been out now for over 7 years, November. So these are shaped implants. The shaped implants only came out a year ago, FDA approved. Former implants were round, so they were always a little bit more full at the top.
Right.
When doing breast reconstruction particularly, you want it to, the whole breast is shaped by the implant itself.
Yeah. It's amazing. It looks, you know, from the profile and everything, it looks really real, but before the show I got to play with it. And it feels real.
Yeah.
Right.
We even tested it out on a little bit of the crew, men in the crew, and they thought it felt pretty real. One guy closed his eyes while he was touching it and said, yep, I think this feels real. So kind of impressive that technology and science has gotten to the point where they care what that feels like and looks like. Before we get into the cool sculpting, let's talk a little bit about how you choose a good provider. What makes a good plastic surgeon and a good practice?
Well, one of the things that our national society, the American Society of Plastic Surgeons, has been really trying to push for is make sure that we talk about those things, that we get it out there, that choose a board-certified physician, or in plastic surgery case, a board-certified plastic surgeon. The ASPS, the American Society of Plastic Surgeons, has their own website. You can go on there, put in a zip code, find local providers, but you want people who've gotten their board certification. That's the number one thing.
American Society of Plastic Surgeons, in case
correct.
somebody's looking for it. Okay.
And then, you know, there are some crossovers which, you know, and I'm not going to go into the details, it's probably way too political, but that are maybe more comfortable or less comfortable in terms of who's doing what. And I think if you're a patient out there, just think about who's doing the procedure, because if you're being treated for a plastic surgery procedure by someone who really is a field very far from that, you probably shouldn't be doing it.
Right, right. And you work at several hospitals, right?
Yes, although I'm primarily a Bay State, I do some work at Noble, I do some work at Mercy, I do some work at some of the surgical surgery centers.
What's a typical day like for you? Is there a typical day?
Well, they're not really typical in that I do 2 full days of operating with day state procedures primarily. I do a half day of minor procedures, 3 half days in the office, and a half day that can be almost anything. So they're not typical, but they're pretty standard.
Wow, wow. Leah, for you, what's that like for you? What's a day like for you?
I spend 2 full days in the operating room with Dr. Broooks, so we usually do 4, maybe 5 surgeries a day, depending on the surgery, of course.
Wow, 4 or 5 surgeries a day. Wow, okay.
We're very efficient together.
Evidently.
It always strikes me that patients and the lay people think, oh my God, you do all that surgery. But you know, if you have a regular desk job, you're sitting there for 8 hours, you wouldn't think twice about it. We're in the operating room for 8 hours, but that's what we do, and it's not stressful for us.
Right.
No, I was just thinking about the organization, how important it is that you get everything correct in every surgery. And these are people, I mean, we're not shuffling, you know, 8 files a day or 5 files a day. And so, you know, this is high stress. I mean, you're doing this for hours at a time, right?
It's not necessarily stressful for us, because this is what I do for a living. I've been doing it for 20 years. I'm very comfortable. It's like you talking to me. I'm probably less comfortable than you are, for sure, in this setting. But I'm more comfortable. I'm more comfortable in the OR than you are. But you know, when you talk about not necessarily the stress, but the organization, and one of the things that's happened in the last few years, there's been a real push to really be very exact about marking patients, doing a timeout, which you actually discuss the procedure you're doing, what medications we're giving, who's in the room. Everybody's introduced again, even though you've worked with them maybe for years. Everybody's introduced. We make sure we know exactly what we're doing, so that there's no question about we have wrong patient, wrong site, or anything like that. We review that right before the surgery, before we do anything. So there's that comfort zone of, okay, we're all really prepared for what we're doing here.
Yeah, and the preparation that our staff does, you know, in the background, so that our days do flow effortlessly, is priceless.
Yeah, it's a great staff. I've gotten to talk to them a lot. They're a great staff. Just even in prepping for the show, they were everybody was very helpful. Oh, let's see, one of the things, what did I hear about? Dogs, family. I heard about all the human things. How you always put reconstructive surgery, breast cancer people, and people getting reconstructive surgery at the top of your list to make sure that you make room for them. That was a common thread through anybody that I asked. I don't think that, maybe that's very common for plastic surgeons, but that's the real human side of you that I got to like.
You know, surgery is a funny specialty, because when you look at medical doctors in general, they have patients that come see them every year, once a year, and they get to know them and their families and their lifestyles. For most surgeons, you don't have that. You do one surgery. If you do a knee replacement, you see that patient for 6 months until they're well on their way, and you probably don't see them again. But for our patients, many of them we see multiple times, but especially the breast reconstruction patients. Number one, they're often in for more than one procedure to get to an end point. And we get to know them at first in a period of a very high stress for them.
Yeah, it has to be so hard.
So we have to make them comfortable. We have to give them advice. They often don't remember any of it. We have to often review it afterwards. And then, once we get through that first operation, very stressful, then the other operations are a lot easier in terms of the stress, but no less important to the patient in terms of what we're doing. But I get to see them over the course of 1, 2, 3 operations, many years of time, and a relationship that really goes much longer.
Rays of Hope. You do the Rays of Hope thing?
Yeah, that's been a great part of the practice, and I love the fact that we go to Rays of Hope. We have the same booth every year. All of my employees come out there and walk or run, and the patients come by. I'm getting a little choked up here. I get a few dozen roses. We give out a pink rose to all the patients, and that's really a special part of my practice.
You are choked up. I
am a little choked up. That is very special to me.
I know, and that's exactly why I brought it up. Jaja in your office was the one who I asked for some human details, and she pretty much, I don't want to embarrass her, but she pretty much gushed in an email about how wonderful you both are and how you always put reconstructive surgery first, and that you go to Rays of Hope and you give them these roses, and you make sure to go and meet with people, and you really enjoy doing that, catching up with them.
Those are the true rewards of what we do.
You just have to put yourself in the patient's shoes, and thinking about them waiting and thinking about them dealing with their diagnosis. And like Dr. Broooks said, we often see them before, during, and after they're done with their therapies, with their chemotherapy or their radiation. Sure. And so they have to sort of feel at home in our office, and we want to provide them the same care as a patient coming in for other procedures. And we do something in our spa for our breast cancer patients, survivors on the green.
Yes.
Because we strive to provide our patients with that spa-like environment. Yep. Regardless of why they're there to see us, we don't want them to have to wait. We have a consumer-based practice in our spa and in our elective surgery, our cosmetic surgery, and so we really try to relay that into all of the patients we see in the practice to make it a comfortable, efficient system for them.
Yes.
And it really does. I mean, breast cancer touches a huge, broad range of women that it doesn't isolate to any demographic group, whether it's age, race, or anything else.
And you mentioned women, and I was just thinking cosmetic surgery is certainly not only for women, and there are men that choose to do these kinds of things. There are men that get breast cancer. There are men that need breast reduction. There are all kinds of things that men would opt to do. And in today's day and age, where you want to look your best and feel your best in the workplace and all of that, I think that that's becoming less taboo for men to come in and see that. So we have to get to the cool sculpting. My guests today are Dr. Glen Broooks and Leah Kenny, and we are going to talk about cool sculpting. Now, this is where I said freezing your fat. I'm fascinated by this machine. The floor is yours, Leah.
I think everybody's fascinated by this machine.
It's amazing. What's the deal?
Okay, so what this does is we place one of the fat depositions, picture a love handle, maybe a bra strap roll, into the suction cup. There's 2 plates within the suction cup that will thermogenically cool the fat to 12 degrees Celsius.
If you tip it up just a little bit, I bet we can see those plates.
So at 12 degrees Celsius, the fat cells will actually crystallize. So think of putting a stick of butter in the freezer. It's going to freeze before water. 0 degrees Celsius was when we would freeze water. So because the skin has a higher water content, we won't injure the skin at 12 degrees Celsius. It stays for an hour, and we cause injury to about 20% of the fat cells. As those fat cells then thaw out after the treatment, they go through apoptosis, which is cell death, and they absorb, and they're just excreted through your lymphatic system. So for spot reduction of trouble areas, this is really a nice alternative.
Okay, so in layman's terms, you put this on a person's fat area. It freezes the fat, essentially.
The fat cells. Without injuring the skin or the blood.
Once the fat cells die, the body absorbs those fat cells and gets rid of them, just like anything else that it would absorb that has died off. Right, like a bruise. That's a great example, like a bruise.
Yep.
Okay. Who developed this? Do we know who developed this?
It's actually an interesting story. It was a Harvard-based dermatologist who saw kids who sucked on a lot of frozen popsicles get little dimples.
Cut it out.
Absolutely. This is the story we heard.
Are you serious?
It's called popsicle paniculitis.
You don't get this just anywhere, folks.
Right?
Okay.
And he realized that the freezing point of fat was certainly at a higher temperature than skin or other tissues, and that maybe we could use that concept, that model, to actually freeze fat at a point where skin or other local tissues don't get injured, and conservatively do a treatment to get rid of fat. And that's the key. We talk about liposuction all the time. Liposuction people go on YouTube and they say, I'll never do that, because it is invasive. But when you're asleep, you don't know that. That's the good news.
Right.
But it is very effective. It gets rid of 80% of the fat, and it does it very well. But you have downtime with it. There's associated discomfort. There's some bruising.
Right. People are out of work a little bit.
Out of work
like
for a little bit. And it's expensive. The cool sculpting, it doesn't have the same single treatment effect, but it can get rid of 20% of the fat. And for someone who doesn't want that downtime, a lot of men don't want the downtime. A lot of women who don't have the time don't want the downtime. You can get your love handles, you can get the bra strap roll, you can get a little bit of belly fat. And for people who are very physically fit, the Gold's Gym person who goes all the time, but then has this little bit of fat in their love handle, says, I just can't get rid of that. Oh, it's perfect.
The tummy for women, it's always the thing that plagues people. I can remember as a kid, my mother always had this little tummy, and it was just like accepted then. But now we want flat. Right. We want no tummy. You mentioned women without time, so women with kids and that sort of thing can do this. And
careers, yeah.
How long does it take before they see some sort of results from this? Is it instant? What does it take?
You're going to see some fat loss within 2 to 4 weeks of treatment.
Okay.
The majority 2 to 4 months. So we wouldn't retreat an area for 2 to 4 months unless I knew it was going to need a second treatment. A larger area, not just a spot reduction, but somebody that we wanted to debulk, then I might treat them as soon as 6 to 8 weeks after that first treatment.
I like debulk.
Yeah, debulking is for
I like it.
people that might need multiple treatments.
Right, and understand this is not for someone who's really significantly overweight.
Right.
It's not going to really have that kind of impact. But for someone who has a modest or small areas of fat, it's very effective.
Okay. And it is a 20% reduction in fat?
Correct,
Is that
per treatment.
And liposuction would be what? How much?
80%.
About 80%. Wow, so big difference. But is there bruising with this?
So some patients will get a little bit of a change in the skin, almost like a large hickey from the suction.
Yeah.
And some people will get bruising.
Yeah.
People with that fair skin, white skin, it's often hard to do anything to them without a little bit of change in the skin. So you could have bruising. So be careful not to do it during beach season if you're going to be in a bikini right afterwards. But we do it in the spa. We use a massage table. The patient's comfortable. Each area that we use the machine on takes 1 hour.
Yep.
So often they'll come in for 2, maybe 3 hour treatments. We have an iPad. They watch Netflix. We do another area.
So
we want them to be comfortable.
Yeah. And then the worst part is after we take this off, we have to massage the tissue. We want to push those fat cells nice and deep to perhaps carry some of that injury to a deeper layer. That's uncomfortable. But after that, you have a little bit of numbness of the skin, sensitivity if you press right on the area, which as women, sometimes we can't stop doing. Does it hurt now? Does it hurt now? Does it hurt now? But essentially you can resume your activities. I tell patients they can go to Zumba if they feel up to going to Zumba. Certainly doing that won't hurt what we've done. It's a patient, whether or not they're comfortable doing it afterwards.
Wow.
So
and understand that I didn't jump on this bandwagon right away. I really looked at this machine for nearly 2 years to make sure that the numbers are real, that there was consistency of the results, that it would be valuable for my patients, because my patients are long lasting. This is a small community. If you do something that's really not effective, everyone talks that that he's trying to sell something. And the goal is to actually provide a service that really is reproducible.
Well, those of us who know you know that you're certainly very methodical and very careful in what you choose to do. There's nobody would ever accuse you of jumping on any bandwagon that I know of.
No, I mean, you want to get results, but you don't want to put the patient at risk to get there.
Absolutely. So you folks are the only people doing this in Western Massachusetts.
Correct.
Tell us how, if somebody needs to get in touch with you, they can reach you.
Well, they can call us at the office. It's 413-565-4400. They can go online. It's
I've forgotten what it is too.
Dr. Glen Broooks, www.drglenbrooks, and they'll find us there. They can go to the Cool Sculpting website, coolsculpting.com, I think it is, and find us through there.
Oh, and on Facebook.
And on Facebook.
And I think we're on Twitter too.
We're on Twitter also.
Yeah. And they can find you at Power Down Det Facebook at this point when the show is up. So I want to thank you both for coming. I know we have to ship you off to go do surgery or office practice or something important, but I can't stop staring at that machine. That's amazing. So look at that thing. It's amazing. That one little machine can get rid of 20% of your fat. So I thank you both for coming.
Thank you for having us.
It was my pleasure. This is Dr. Rahaim, Dr. Broooks, and Leah Kenny reminding you until our next chat, keep it positive.
There's a better life if I could be debt free, but all my money is a mystery. I was feeling overwhelmed and it was wearing thin when I knocked on the door and heard the doctors in. What Oh, the doctor's in, the doctor's in. She got the right prescription to help you win. Oh, the doctor's in, the money doctor's in.